You're listening to the Jōrni Podcast. Ever wondered if allergies could influence your mental health? Tune in today to learn more. Hi, I'm Petra Brunbauer, and with decades of experience with sadness, pain, anxiety, and stress, I finally figured out how to leave all that behind. And this podcast shows you how to break free permanently so you can reclaim your sanity and find the self-esteem and energy to go after the life you desire. With real talk about mental health, holistic healing, and the tough journey of coming out the other end. This is the Jōrni Podcast. Welcome to today's episode. In this episode, we explore the surprising connections between allergies and mental health, examining how allergic reactions can impact mood, energy levels, and overall well-being. We discuss how managing allergies effectively can lead to improvements in mental clarity and emotional stability, especially if we're dealing with chronic allergic responses. Dr. Manan Shah is a founder and Chief Medical Officer of Wyndly. As Chief Medical Officer, Dr. Shah oversees every aspect of Wyndly, which interacts with patients and many that don't, including patient experience, provider experience, medical operations, marketing, and customer support. He's led Wyndly from just an idea to its first patients to the fully functioning medical practice and company it is today. Dr. Shah is academically active at national and local levels. He has published multiple peer-reviewed articles in medical journals and book chapters. Additionally, he gives presentations and lectures locally and nationally on topics relating to otolaryngology. He was nominated by local colleagues to serve as the president of the Colorado ENT Society and also elected by his national peers to serve as the secretary of the YPS of the American Academy of Otolaryngology and is also a member of the Academy's Telehealth Committee. Prior to Wyndly, Dr. Shah completed his medical school at the University of Maryland and pursued an additional certification in clinical research. He subsequently completed his otolaryngology head and neck surgery training at the University of Connecticut. Here is my interview with Dr. Manan Shah. Hi, Manan. It's so great to have you on the podcast today. I've been looking forward to getting to chat with you because allergies and mental health is a really fascinating topic, and I actually don't think we've talked about it before on the podcast. So thank you for being here today and welcome to the podcast.
Thank you so much for having me. We're so excited to get to chat with you and to talk about this sort of strange connection between these two seemingly unique diseases.
Yeah. And come to think of it, I don't actually know a single person that doesn't have an allergy. So I think this is a really relevant time. I'm just going through my mental kind of family and friends, but I don't know anyone who doesn't have an allergy. So I think this is a really relevant thing to talk about today and definitely make some connections and let our listeners know a little bit more about it. So would you like to start us off with maybe a bit about yourself and your own backstory, your own journey, and kind of how you came to work with what you do today and how that brought you on that path? That would be amazing.
Yeah, I'd love to. And again, it's so exciting. So essentially what we're going to be talking about today is just how allergies can affect your mental health and your sleep and your wellness and just overall how you feel. And that sort of brings back to my personal journey. So I'm what we call an otolaryngologist or an ear, nose, throat physician. What we do is we focus on treating diseases of how people breathe. We do surgery on the nose, on the windpipe, on the mouth. We take tonsils. We basically operate and treat diseases of anywhere from where air enters your mouth and your nose all the way down to where it meets your lungs. There's a different doctor that starts to work on you when it gets to the lungs. So during my training, of course, I'd always been interested in the field because I was a musician and I liked this idea of working with people in the way they sing, and I liked, breathing and all these things. But of course, as fate would have it, there was a sort of an episode that made it really personal to me. And so I was dating this woman and I knew she was going to be the one. And I went to go to her parents' house and spend some time with them. And it turns out they had a cat. Now, they didn't even have the cat anymore. The cat was gone. But it was on that day that I'd always known I had a little bit of a cat allergy, but this was the first time I realized that my cat allergy was incredibly severe. And so I went over and I used a blanket that the cats had used, and the cats had probably been dead for almost a month at that point, but there was enough cat dander on it that I had a severe allergy reaction. We actually went to the emergency room because I was like swelling up and having hives and a little bit of trouble breathing. And it was probably the most severe cat allergy reaction that I've ever even seen. I've only met maybe one or two other patients who've ever had that. It's so rare. But it was just this really sort of scary moment where I had this sort of feeling of a loss of control, right? And I'm a surgeon, right? And many surgeons, we love to be in control of the situation and we feel very on top of our health. But something in the environment just triggered my body and my body was going to react. And so I became interested in how can I fix this? And that's how I sort of went down the journey of learning about what we call immunotherapy. It's this concept where you can retrain your immune system. You effectively expose your body to a small dose of what you're allergic to. And over time, that repeated exposure causes you to become desensitized. And so I did this desensitization myself, had a really great experience. I'm now able to hang out with cats with no trouble. And it's just been life-changing for me. And so when I started practicing, I started offering this treatment as well. But I realized this was something that's really big in Europe. So many of your listeners may be exposed to it, but it was not yet big in the United States. And a lot of that's due to the nuances and the financial incentives of our healthcare system. And so we had this mission to bring it to everybody, right? I had exposure to it because I was at an academic university and there was a researcher who was offering it. And so they weren't really worried about the financial part. They were just worried about doing their studies. And so I was able to get this incredible treatment that changed my life. But I wanted to make sure everyone in the United States could have it. And that's how we came to start this company called Wyndly, which is our telehealth platform to let everyone get access to immunotherapy.
Oh, that is fantastic. Thank you for sharing your journey and your story. And I can definitely relate to that. I have asthma and I love cats. So the combination is sometimes very difficult. So
Yeah.
it's really great to hear that there are ways that we can work with that and that we can actually help ourselves get desensitized to some of these things. There's a lot of people who can't go outside at certain times of the year, or they really suffer, and it impacts the quality of life and obviously their physical and mental health as well. So yeah, I love the idea of being able to work with that. And it is more common, I guess, here in Europe, but is it gaining traction in the United States? I think there are a lot of allergy sufferers there, right?
Yeah. So in the United States, which is where I'm located, my physical practice is in Denver, which is in Colorado, one of the states in the US. In the US, we find that there's 80 million sufferers of allergies. That means 1 in 4 Americans is suffering from some type of environmental allergy, whether it's ragweed or dust mite or mold or pet dander. People are suffering. And one of the challenges I think that we have in the United States is people seem to think the treatment is just to take pills and sprays, right? Everybody thinks they should just take Flonase or Benadryl, which is like a diphenhydramine, which is a type of antihistamine. People just think they should take antihistamines or nasal sprays, right? There are steroid nasal sprays like Flonase or fluticasone, and people tend to think that's just what they're supposed to do. And part of that's because we've done a really good job as physicians at educating people that if you have, an allergy symptom here and there, that you can take a pill or spray to fix it. But these medications have some side effects, and these medications probably shouldn't be taken every day for your whole life. And we have not done a good job as physicians at letting people know there's a way you can actually fix your allergies, right? Everybody knows that if you have glasses, you can get LASIK and then see better. There's a permanent solution. Everybody knows that if you have crooked teeth, you can get Invisalign or braces and fix your teeth. But we just haven't really done a good job in the US healthcare system of letting people know that you can actually desensitize yourself to your environmental allergies, that it's something that you can pretty easily fix. And a lot of the problem is the traditional method was what we called allergy shots. You would have to go into a physician's office and you'd have an injection once a week for a number of years. And you'd have to sit there in the office for about 30 minutes after the injection to make sure you didn't have any type of allergic reaction. I think that treatment option has turned off a lot of people from the idea of desensitization because people are scared of needles and people are busy and they don't have time to go to a doctor every week. But what's really interesting is in the European healthcare system, and more recently in the United States healthcare system, there are medications you can take by mouth that work just as well as the shots and desensitize patients. And so again, part of like our mission and our practice is to just let people know this even exists and give people an opportunity to do it in a comfortable and convenient way.
I like the idea of that because I do know some people who had the therapy by needle, and one of them had such a severe reaction. They ended up in the hospital in the emergency. So definitely this sounds like a much better and safer way to go for people. I'm curious, does this work just for environmental allergies, or are we also talking about food allergies? For example, people who can't eat gluten or different kinds of food dyes or preservatives or things that come up. Does this work for everything?
Yeah. So the easy answer is yes, you can desensitize yourself to a number of different things. Not everything, but a number of different things. Now I'm going to get into the more complexities. With environmental allergens, the technique is a little bit different than with oral or food allergies. But in both, the general idea is if you expose the body to a small dose of something routinely, in many cases, the body can become desensitized. Environmental allergies, it's pretty easy. It's a drop or a tablet that you take under the tongue. You leave it there for a minute and it absorbs. And over time, that starts to work. And most patients start to feel better between 3 to 6 months, so pretty quickly. With food allergies, it's a little bit more nuanced. You often have to eat the food, and many times you have to be observed in a physician's office because there is a higher risk of having a really bad reaction with food than there is with an environmental, right? If you're exposed to pollen and you have a pollen allergy, you sneeze and you can feel bad. But other than me, most people don't have to go to the ER. With peanuts, if you have a peanut allergy and I give you a peanut, you can have a really scary reaction. And so some of that treatment does have to be done, observed under a physician. But there's just a bunch of different ways. But the general concept is, yeah, you can fix it. And the reason as an ENT I got involved is because part of what we're so interested in as ENTs is how can we get people to breathe better and sleep better and live better? I think a lot of people don't realize how much your sleep and your breathing patterns can affect your wellness and your overall health. And so the first joke I always make is the nose is for breathing and the mouth is for eating. And if you're not using them for what they're supposed to be there, then like, why did we evolve these two separate structures? But a lot of people nowadays are not using their nose to breathe. They are what we call mouth breathers, which is actually an insult in some of these TV shows in the US. But the reason that people joke about that is because the mouth is not made to filter and clean air. It doesn't have mucus. It doesn't have nose hairs. It doesn't have a humidifying device. That's what the nose does. And if you're not using your nose, you're going to end up having trouble, right? It's going to affect, if you're breathing through your mouth, you can get cavities because you're drying out your saliva. You don't have the filtering of bacteria that you have with the nose, and the air isn't humidified. It can actually contribute to things like sleep apnea, so it can affect the way you sleep, and then you're not as well rested. And so I think one of the things we love to talk about, I'd love to kind of talk about, especially for your listeners, is how does their sleep and their nasal breathing affect their wellness?
Yeah, I think that is such a crucial point that you're making there because it affects everything. Our emotional, mental well-being, our physical well-being. Sleep apnea is one of those things that it can actually shorten your lifespan by what I have read. So sleep is this crucial piece that a lot of us kind of don't even think about because we either get too much, too little, or sometimes insomnia. So, and especially if you have allergies, it is really difficult to get a good night's sleep. So yeah, let's dive into that a little bit and explore that. That sounds like a great idea.
Yeah, so let's talk about this. So at night when you go to sleep, that is when your body can rest and recover from the stresses of the day. But when you sleep, you need to have a constant and steady flow of oxygen. And there's a thing called obstructive sleep apnea, which is where one of the structures in your body, in the pipe from your nose and your mouth all the way down to your lungs, gets narrowed or obstructed, and the levels of oxygen decrease. And when that happens, your body doesn't like it. And if you have less oxygen and your body senses the oxygen levels are dropping, it'll actually wake you up a little bit to try to stimulate you to take a deep breath. It's not, you don't get woken up enough that your sleep is broken, right? You're still asleep, but you don't get that restful sleep. I like to joke, it's sort of like if your partner was just kind of poking you every so often. You'll still stay asleep, but you'll just be like tossing and turning. And when that happens, then the next day you're not able to be there. You're not able to be present. You're exhausted. You're fatigued. And you just don't feel yourself. And that can certainly be associated with things like anxiety or depression or overeating, just all these things that happen when you're not well rested. I remember when I was a kid, I would love to stay up late and go out, but now that I'm getting older and I have all this information around it, one of my number one appointments each day is getting to bed. Right at 10 o'clock, I got to be in that bed and I got to have the lights off and I need to sit there for ideally 7 to 8 hours. Because if you're not doing that, you just can't perform and feel good the next day. And so part of what we focus on at Wyndly is how can we help people breathe better? Because if that pipe is clogged from the nose and the mouth into the lungs, then there's no way you're going to get that restful sleep. And part of the reason we focus on allergies is that's the number one cause of obstruction. It's the most common reason why people can't breathe through their nose. Now, of course, there are anatomical issues, right? Your structures in your nose can be bent. You can get what's called a deviated septum, which is when the cartilage in your nose is bent. Or you can have chronic sinus issues, or you could have a polyp. Some people even have tumors. Those things can certainly happen. But when you look at the statistics, most people, the number one reason that their nose is stuffy is because they have some sort of environmental allergen. And as our climate changes and gets warmer, we're seeing that these plants are releasing pollen for longer seasons and earlier each year and even more, right? Plants, if you remember from your high school biology, plants respond to carbon dioxide, whereas humans use oxygen. So as we pump more carbon dioxide into the atmosphere, for whatever reason, it's a fact that there's more today, you're going to see that plants and weeds are going to grow faster and bigger, and there's going to be longer pollen seasons. And so we're seeing that with allergy seasons increasing every year in every country. And what that does is the allergen comes into your nose, it irritates the tissue inside your nose, you get swelling inside your nose, and you get a runny nose, a stuffy nose, you sneeze, you just feel annoyed. And it might only be like so low that you don't notice it, but you just feel like you can't breathe through your nose. And what that does then is then at night when you try to sleep, you're not able to breathe as well through your nose. You end up breathing through your mouth, and you get some of those sleep apnea-like symptoms sometimes. And so that's what we really think is we think that if we can help people breathe through their nose, they're just going to get better quality sleep and they're going to feel better. In fact, you're seeing this sometimes. There's a thing called mouth taping people talk about, where people are trying to close their mouth with tape to ensure that they breathe through their nose. And mouth taping, there's not a ton of data on it, but I think the idea of trying to breathe through your nose is really meaningful. But again, if you have bad allergies and your nose is stuffy, you can tape your mouth all day, but you're still not going to be able to get good restful sleep.
Yeah, you'll be struggling with that during the night. You touched on something really interesting there, and that is also that some people might have sort of a low-grade inflammation going on where their nose is probably just enough stuffy that they might notice a little bit of irritation, but they might not relate that to allergies or even environmental allergies because it could be really anything around them and they might not be aware. So how do you kind of train people to understand what is happening if they are thinking, oh, maybe it's just a cold, or maybe I have the flu, or I ate something that gave me a reaction? So can people actually kind of become more aware and attribute this to allergies so they can work with you after to resolve that? Or how do people become more aware of that?
So I think that's one of the biggest things. Again, is people, in the United States, we think of allergies as not a real problem, but they really are. They have all these downstream health effects. And it's been hard traditionally for people to actually get tested and figure out if they have allergies. One of the things we're on a mission to do at Wyndly, and I think you're seeing this across the country, is to make it easier for people to get tested. There's so many ways of getting allergy tested. You can do the traditional method is you can go to an office and you can get skin prick tested, and we do that in our office. And it's a great method and it gives great results. But some people are a little bit scared of getting stuck a bunch of times, or they don't have time to do it, or maybe they're worried about their health insurance because in the United States, health insurance is expensive and you never know what it's going to cost. So now we're also at Wyndly, we offer people blood testing, which has, some limitations, but it's incredible and that it's easy. People can do it from home. They can go to a local center and get their blood drawn, and it's one stick instead of maybe 60. And so again, our job is to provide access to make it easier for people to get the care they want to get. And we try to meet patients where they're at, right? The traditional healthcare system, the idea is like, it has to be done the way the doctor wants it to. But I think what we're seeing now is we need to meet patients where they're at and give them the kind of care that they're looking for. And so what we do is we let people get tested, and then we have them meet with our doctors to talk about like, hey, do you actually have allergies? You may not know that you have allergies. You may just feel chronically just unwell. And sometimes it's worth getting tested and trying to figure out, is this contributing to my health issues? There are also some easy home ways that your listeners can do. Is like one of the things I love to talk about is a saltwater rinse or a topical nasal spray, right? And I don't want people to be on these nasal sprays and medications forever, but it's totally okay to use them for a week or two and test out, right? Sometimes you'll find patients who will use something like Flonase and then they're like, man, I feel so much better after using this nasal spray for a couple of weeks. Well, if you're using an allergy medication and you're feeling better, it's very possible that you have allergies. And so sometimes using a saltwater rinse like a neti pot or a nasal saline mist can or a Flonase for a couple of weeks is just a really easy way to test out, like, does breathing through my nose, does fixing my nose make me feel better? And so we'll have a lot of patients who try that and they find out like, yeah, it helped. And those patients then come to us and they get tested and they find out that maybe they do have an allergy. We have patients who've had a cat and they've had a low-level cat allergy. Now, if they don't have any symptoms, again, then we have to talk about, it doesn't matter. But if their symptoms are that they're always stuffy or that they always have a little bit of a runny watery eyes, I think it's worth trying to get it fixed. And that's sort of our goal here. There's just like this really interesting studies that came out where they found that people who had allergies had a higher risk of having depression, right? So it's literally like the allergy sufferers are roughly twice as likely to have depression as people without allergies. And that's really weird because, as a scientist, I have not seen any sort of like direct correlation where like, hey, allergies lead to depression. But I think maybe what's happening is it could be that if you're not breathing well through your nose, you might not be sleeping well. And then that can affect, insomnia can affect anxiety and depression. It might be that you're taking antihistamines all the time and those medications are sedating. Or it might just be that you feel bad. And that low level of just feeling bad and not feeling yourself can affect your mood. And so there was like a really interesting study in 2005 at the University of Maryland, which is where I went to medical school. And they found that peaks in tree pollen levels actually correlated with increased levels of suicide in women, which is crazy to me. It's so weird to me to think that a disease in your nose, such as allergies, can affect people's depression. But the data suggests there is. Now, of course, there can be studies for everything. And so I always tell people, take this with a grain of salt. But what I think the message we want people to know is like, if you're feeling bad, it may be worth getting tested to see, is this something that's contributing to your symptoms? And we try to make it really easy to get tested.
Yeah, thank you for sharing that. That is definitely a very interesting insight, and maybe also encourage us listeners to be a bit more aware of these connections where we might just write it off as a runny nose, but in reality, it is actually affecting a lot of things in our lives without us knowing about that. So definitely take a look. And if you're thinking that you might have some allergies, get yourself tested and see what comes up, because that might actually, well, by the sounds of it, it might actually save your life, even if we're talking about suicide and pollen. So that seems to be a very important part there. So the testing, when you do blood tests, is that as effective as when you do the skin prick tests, that you can tell all the things that people are allergic to with that?
So I always tell people the simple answer is they all work great. The most important thing is not actually the test. It's meeting with the doctor and making sure that your symptoms make sense, right? We spend a lot of time in our practice saying we don't treat the test, we treat the patient, right? If you do a test on me for allergy skin testing, you will find that I test positive to dogs. But I have a big 90-pound golden doodle and he sleeps in our bed and he hangs out with me all day and I have no symptoms to him. So in that case, the test is giving what's called a false positive, right? And then sometimes a test can give a false negative. And so every test has its pros and cons, right? Skin testing is really good. It's traditional. It is covered oftentimes by insurance, and it's really sensitive at picking things up. But sometimes it can give false positives. Blood testing is the other way. It can give false negatives. It can miss stuff. But again, that is why you want to meet with a physician and try to figure things out. And what I tell patients is, look, if you're scared to get skin prick testing, then do blood testing and it's easy. Or if you're too busy, or if you want a convenient way, the key is to find the way to get the information in a way that makes sense. And most importantly, the key is to work with a provider who's going to listen to you and try to figure out what is really going on with you. Because it's not just about like taking a test and then being treated for what you're tested for. It's about making sure it makes sense with your symptoms. In our textbooks, we often talk about how allergy is a history-based diagnosis, meaning it's based on the patient's history. But it's really easy in today's world with data to get so wrapped up in the data that you're missing the forest through the trees.
Good point, and thanks for pointing that out. Now, as you're explaining, I am wondering in my head, what happens when people actually have multiple allergies? So we have a cat allergy and a dog allergy. Also, we have a pollen allergy. I'm allergic to trees and sort of grasses and horses, a whole bunch of things. So when I come see you and we begin this desensitization or the treatment of these allergies, can we treat these multiple ones at the same time? Or is this something we have to do sort of one by one?
So you can treat multiple allergens. You have to have a customized treatment plan made by a physician. So in the United States, at least, there are FDA-approved tablets that will treat a single allergy. So let's say you only have dust mite allergy. You can take an FDA-approved tablet called Odactra. There's a version of it in Europe as well. And those work really well for many patients. The challenge is if you're like you, let's say you have a dust mite allergy and a tree pollen allergy, or you have dust mite and you have tree and cat. Then what your doctor does is make a custom compounded formulation. They'll write a prescription specifically for you. They tailor it towards your allergies, and you take that every day instead of the tablet. And over time, that desensitizes you. We do that with shots as well. With shots, we'll sometimes tailor the shots for what you have. We can do that with our allergy drops as well. And so the key again is to work with a provider who's going to give you a treatment plan that makes sense for you. Sometimes the tablets make sense. Sometimes the drops make sense. Sometimes shots make sense, right? I do tell patients for venom, we think that shots are really the only thing that work, right? So if you have a bee sting or, some type of venom allergy, shots are really the only one that have data. But again, the key is to find a provider who's going to figure out the best treatment for you. And I think what we really want to focus on at Wyndly is letting people know that you can get this information in a really easy way and you can get treated in a really easy way. A lot of people think they have to wait 3 months to go see an allergist and get a skin prick test and sit in a waiting room and go to sort of the traditional cattle car sort of, US healthcare system where you feel rushed and you get 10 minutes with the doctor and you're running in and out. You don't have to do that. We can make it really easy for you. And that's sort of what we focus on. And I think that the top line, though, is yes, you can desensitize to multiple allergens. You can even desensitize to multiple foods. And so there's a lot of really interesting treatments that are coming down the pike that patients maybe weren't aware of.
Yeah, that actually sounds really great to kind of work on multiple things at the same time, because having to go back for each one and then do the 3 to 6 months could take quite a while. So that sounds a lot more efficient. Now, is there anything that our listeners would need to be aware of? So if they would like to start a treatment like that, they've had tests and maybe they figured out a sort of personalized plan with their healthcare provider, is there anything that they need to be aware of while they are doing these kind of treatments? Any precautions that they should know about? Anything that might be affecting them during this time that they're doing these treatments?
Yeah, so the biggest risk of allergy desensitization is that it triggers your allergies. And sometimes it triggers them in a small way, right? You'll get a little rash, or you'll get hives. Sometimes it can trigger them in a big way. You can get a really scary allergy reaction. So generally, we don't like to start this type of treatment on someone who's pregnant because we just don't have data on how a pregnant person would do. And you just want to be a little bit more cautious. We are fine with people who are breastfeeding doing it. We're fine with people who have started to continue their treatment once they're pregnant, because if you've been on a treatment for, 6 months to a year, then the chances of anything scary happening are pretty low. But we just don't start it in patients who are pregnant. But I would say, again, what I want your listeners to know is let's say you're someone who thinks maybe you're having bad allergy symptoms. The most important thing to know is that there is a treatment option out there and that this could be affecting how you feel day to day. It could be affecting your wellness, your sleep, just how you feel, how much inflammation you have in your immune system. And if you're in Europe, you can go see your local primary care provider. And I know that in Europe, this is offered by a number of different providers. And sometimes it's even given out through pharmacies, I think. In the United States, things are a little bit different. It can be hard to find providers who will do this because many of the traditional providers have been trained on shots. And because shots are what insurance covers, that's usually what you're going to be offered. What we want to say is that if you're in the United States, Wyndly, our practice is available in all 50 states. And so you can just go to our website, wyndly.com, and you can schedule a consult with a physician, and we try to make it super easy. But ultimately, we just want patients to know that this is even an option, that you can learn about it. And I think a lot of people just don't realize there is a correlation between seasonal allergies and anxiety and depression, and it can be really complicated because, again, as I mentioned, there is no great science. There's these great studies that show hey, on a population level, people with allergies tend to have a higher risk of having depression. But then as allergists, we're like, well, we don't really know why. We don't have like we can't say like, hey, it's this molecule that causes it and this. But we do know that treating it can sometimes improve how people feel.
Yeah, that's the important part, is that we actually start to have this quality of life back that we have without all the allergies going on and the inflammation going on. Yeah, that's very interesting. And so you've touched on how people can get a hold of you. They can basically do a teleconsultation if they want to, or a personal, they can come into an office as well.
Yep.
Is there any other programs or services that you offer, education or anything that our listeners can take part in?
Yes. So one of the things, again, as a physician, a lot of our job is to educate people. And so, I didn't know that this program or this type of treatment even existed. And I only was exposed to it because I was at a university program where I had a mentor who was doing it, right? And some mentors who were doing it. But it wasn't something that even in med school, I hadn't even learned about it. I only learned about it in my residency. And so we've tried to make a ton of educational content. We are on Instagram, we're on YouTube, I think we're on TikTok, but we have a ton of YouTube videos where we talk about how allergies can affect you and what different treatment things are. And so if you search for Wyndly, Wyndly, and YouTube, you'll find a ton of videos where I'm just explaining this stuff. Because again, part of the fun of being a physician is getting to educate patients about the options that they may not know that exist.
Perfect. And we, of course, will be linking to all of your offerings in the show notes as well. So our listeners can make sure that they have a look there. I think that education is probably a big step for many people who may not be too familiar with this topic. So great place to start. And then, of course, have a consultation, speak to someone, get yourself educated about what's going on with your health so that you can be better, have better well-being, and actually enjoy life a little bit more. I know that once the cat allergies are sort of desensitized, I think life will look a lot more glorious and you can hang out with cats and pet them, and that makes life a lot easier. So I think working on allergies is a great thing.
And one of the big things we've had, like the stories we hear from patients is like, hey, I never really used to enjoy being outside or hiking.
Yeah.
And people didn't even realize why. But then when they thought about it, like, it's just because like every time I went out, I just felt like stuffy and sneezy and miserable. And now we have patients who, especially here in Denver, who are spending a lot more time outside. And again, there's definitely a clear correlation between time like spent outside and exercising and mental health. And so again, a lot of what we want to focus on is how can we get you feeling better and get you back to doing the things you love doing? Maybe that's spending time with your pets. Maybe it's spending time outside. Maybe it's just being able to go to your kid's lacrosse game, right? And so we have parents who are like, I never used to go to my kid's soccer game because my allergies were terrible. Now I'm watching the kid and it's fun. And so I think those sorts of stories are what make us really excited.
Yeah. Thank you for sharing those. And listeners, take a look at the show notes, connect with Wyndly, find the resources on YouTube as well, get yourself educated. And it is my hope that all the allergy sufferers out there actually find the help and, like you said, improve their quality of life and get to do the things that maybe they've stopped doing because it's just been too complicated with allergies. So absolutely. So thank you for sharing your wisdom and knowledge on all of that with us today. It has been an incredible episode. I feel like I learned so much. And thank you for spending this time with us. It's been an absolute pleasure to have you here today.
Thank you so much. I really appreciate it. It's such a pleasure to be here. And if your listeners have any questions, please reach out to us. We're always happy to talk about this stuff.
Absolutely. We'll make sure we link to the contact as well in the show notes to make that really easy for them to get in touch. So thank you so much again, Manan, for being here, and take care.
Bye.
Thank you so much for taking time out of your day to listen in. If you enjoy the Jōrni Podcast, please support us by subscribing, sharing on social media, and leaving us a review. We appreciate you. And you can find more of The Jōrni on Facebook, Instagram, TikTok, and our website, thejorni.com. Sending you love and courage, and see you next time.